We at EVMS understand that there's a great deal of fear and concern in the community about Ebola. The purpose of this segment is really to try and allay that fear and get the facts out about Ebola. Ebola is one of the hemorrhagic fever viruses. Ebola spread in bodily secretions. One of the most important facts is Ebola can't be spread before the person with Ebola has symptoms, and that's almost always a fever. In fact, a lot of people don't believe it's really infectious until the third day of fever. So if you're exposed to someone who does not have a fever, you're not at risk of being infected. Once the person becomes infectious, it's the secretions, bodily secretions, that are infectious. So that could be sweat, urine, feces or stool, blood, potentially in sputum, but it's not airborne. It's interesting, this virus is not very hardy in the environment. It's rapidly what we call desiccate, or dies because it dries out in secretion. So when they actually did studies in Atlanta, taking care of the 3 patients they have done there, they could not find the virus on any hard surfaces, even the very high-touch surfaces like the bed rails of the patients. The symptoms, usually the onset is between 5 and 10 days. It can be as early as 2 days or up to 21 days. Almost everyone has a fever. Then interestingly, it's mainly gastrointestinal symptoms, nausea, vomiting, abdominal pain, much more than the bleeding symptoms. In fact, in this current epidemic, a little less than half of the patients have had any bleeding manifestations. So you might see it's now called Ebola virus disease instead of Ebola hemorrhagic fever. And in fact, one of the reasons why there was a delay in figuring out what was going on in Guinea was because they thought it might be a cholera epidemic because there was so much diarrhea and not much bleeding. If you had a possible exposure, the maximum onset would be 21 days. So by 21 days, if you haven't had symptoms, you're in the clear. I think in Africa, they're not getting very good care. If you can imagine, if you had very severe diarrhea but couldn't get any intravenous fluids, you'd have a high risk of dying. There's been much less in the way of deaths in workers who have gotten good health care.